There are promising development. There's an understanding and recognition that there's associated neuropathology. The IDEAS registry is a trial which we are a site for that understands that the amyloid is a pathology associated with Alzheimer's disease. So it would be the American Academy of Radiology, in conjunction with the Alzheimer's Association, has come together recognizing that there's a need to establish the association further of how useful amyloid scans are. And that will be provided, and patients can enroll in the trials here at the Montefiore Health System to further understand that. So it's based on an understanding of the neuropathology behind it. However, a lot of the push on the political level is actually what I've spoke about before, is actually focusing on the caregiver. Mm-hmm. And a lot of the initiatives from New York State is the recognition that we need these centers for excellence to provide this comprehensive care for the patient and the caregiver. So there's no disease-modifying therapy. We've done a wonderful job in multiple sclerosis in identifying the underlying neuropathology. However, there's no disease-modifying therapy. We have medications that have been approved. There's been one new medication, which is just a joint medication, and I could use the trade name, is Aricept and Namenda, or danazepam. Memantine is the generic name. That was approved, but those have been approved previously. So as far as new treatments for Alzheimer's disease, we're not there yet. We're there with the understanding, recognizing that amyloid and hyperphosphorylated tau may be targets of therapy. So there's work to do in the pipeline. We have clinical trials that are the IDEAS registry that are based on looking at the amyloid imaging that I mentioned before. In addition, we are a site for looking at newer amyloid imaging agents as well. I'd like to see the Montefiore Health System and the Montefiore Einstein Center for the Aging Brain take a new direction in the future. We recognize that we're growing as a health system. We're reaching the outskirts north of the bridges here and reaching areas that are rural. Primary care physicians and families may not have access to specialists, and not everybody needs to see a specialist. What we're charged with now is a grant that looks at the HRSA grant that develops clinical care pathways to recognize Alzheimer's disease, to recognize dementia, to determine when patients need to see a specialist. What we're looking for in the future is that I'd like to see telemedicine brought here, is to bring the same multidisciplinary team here at Montefiore Health System and bring that outreach to the doctors. There are models that we're looking into, and one of them I will mention is the ECHO model that's been developed at New Mexico, at the University of New Mexico. So that's a model that has been implemented, and we're looking to expand that here at Montefiore. The ECHO model is a model of care that looks at the collaborative approaches and recognizes the need for and uses telemedicine. So basically the vision that I'd see for the Montefiore Einstein Center for the Aging Brain is highlighting that model, is basically taking technology and bringing it to doctors right now and patients, so that let's say we have a patient that is south of Albany in an area where they do not have specialists, or in a different area north of the Hudson Valley. What I would like to see is to have those practitioners send their difficult patients to us. I'd like to see that chart, review that with an interdisciplinary team, have the doctors call in, and then we could review that patient. So we're able to teach the primary care physicians to further about the management and treatment of dementia in a collaborative approach. And that would disseminate to other patients that they treat, and in essence benefit a lot of patients. It's a new model of care that can be considered as far as telemedicine and patients calling in. Obviously it's been done with telemedicine, with stroke health. It would be nice to see that in the near future. I'd also like to reach out to the primary care physicians who may not have had the education in Alzheimer's disease and the recognition of the related disorders. The Montefiore Einstein Center for the Aging Brain is actually an academic site as well. So at this current year, we have our first geriatric neurology fellow. The accreditation was done through the United Council of Neurologic Subspecialties. In addition, some of the Leslie R. Fox and Fan Fox grants through the Bronx has also allowed us to put in postdoctoral fellows that are gaining additional training in Alzheimer's disease-related disorders, neuropsychology. And it's a rotation site not only for the neurology residents, the geriatricians, the neuropsychologists. We have outside rotators in palliative care that are coming through the Center for the Aging Brain just to learn about the collaborative model. In addition, our social worker, who is funded through the Leslie R. Samuels and Fan Fox Foundation, is also what's called SIFI certified. So we've been working with Hunter College students to provide their clinical training as a site for them. So not only are we trying to provide collaborative care for our patients, we're also very high-powered in academics as well. In addition, we see the need that doctors are busy. CME is easy to come by, but a face-to-face CME, I think, is wonderful. So I've certified the Center for the Aging Brain Interdisciplinary Conference with Albert Einstein and Montefiore as a whole. So there's 2 CME credits that are provided. And what that conference is, it deals with difficult issues or difficult patients or challenging patients that we may have seen, brings the interdisciplinary team together, highlights the most evidence-based literature, and allows for really a face-to-face interaction among these specialists. So it's a wonderful opportunity to kind of present and dazzle the team.